Everyone. I'm excited after listening to the pastor. I mean, that is the absolute right thing to do is invest in the people that are really needy. But I'm Dora Wooden. I'm a phlebotomist at Loretto Hospital. I've been there 19 years. I'm touched to be joined on this call by elected leaders and faith leaders. I appreciate your support because I know you're here because you understand why we are going on strike. I mean, it's a heartfelt thing. We are joined by you guys to understand why we're calling on a strike. We're calling to protect the Black lives in the community as well as our Black lives, but those of our patients and the community. The community means a lot to me. I grew up in the Austin area. That hospital that Loretto serves, it's my community. Sorry, guys, I'm a little nervous. This is my first speech, and I'm excited after listening to that pastor.
You
And
are doing great, Dora.
and let's be clear about something. It's the community that's been devastated by institutional racism. It's a community of Black and brown people, and it seems no matter how hard we work, we all still are stuck in poverty. I work at Loretto Hospital because it's a hospital that serves and helps Black and brown people who don't have other resources for health care. I understand that institutional racism is a factor in why Loretto, as a safety net, doesn't have the same kind of funding and resources as hospitals do in wealthier and whiter parts of the city. But I also don't want you to be a victim of institutional racism anymore. I should say more of a victim. Because if you're Black and you live in this country, you're going to have to deal with institutional racism. And I want to protect our patients and our community too. And that means asking Loretto to do more for us. Yes, budgets, don't budget on our back. Budgets are tight, but Loretto can afford to do better. And we need Loretto to do better. You see, most of our patients are sick and struggle because of poverty, because of institutional racism. Those of us who work at Loretto, we work here to help fight the impact of institutional racism. But we didn't sign up to be victims of it or of our job, on our job. We all know that the connection between poverty and poor health, and especially the connection between stress and trauma that poverty creates, and that kind of mental health issues so many of our patients have. We are preparing to go on strike because Loretto can't effectively help Black and brown communities if its workers are paid poverty wages. Many of our workers cannot afford from paycheck to pay bills. They can't even imagine investing into their 403s. So we're all working below poverty level. We're just asking for them to bring us up. And we're reminded that Loretto management at the bargaining table, we were met with unfair labor practices. Management refused to bargain with us in good faith. But we do have faith. We have faith in each other because we inspire each other with our commitment to help our patients each and every day on the job. Pandemic or no pandemic, no matter what, we were all there. And I have hope that management will realize that you can't fight the disease of poverty while paying poverty wages to us. The result is short staffing that undermines care and stress out struggling workforce. The result is a workforce that will end up with the same preventable health conditions we are working to treat in others. We do not want to fall victim of the institutional racism and the poor wages that has been inflicted upon every healthcare in this country. So that's why we are counting down to strike for Black lives and brown lives. They do matter on July 20th, and why your support means so much to us. Thank you all for supporting us.